Hi, welcome to CROSSFIRE, a combined randomised and observational study of distal radius fractures in older patients. CROSSFIRE is a multi-centre randomised trial that will compare volar locked plating to closed reduction and casting for Colles fractures in patients aged 65 years and over. This presentation is an introduction to the CROSSFIRE study, but it's also a reference for any investigators to come back to. This presentation is divided into sections which walks you through the entire study. And from the next slide on, you will see orange bars on the left-hand side which flag which section you're up to, so you can easily go back and flick through the presentation to find the section that you want. So first of all, the background. Distal radius fractures, or so-called Colles fractures, in older patients are very common, and they've traditionally been treated with closed reduction and plaster. More recently though, surgical fixation using volar locking plates has become much more popular, and in many places now is the preferred method of treatment. But comparative studies have not shown a clear advantage of one form of treating these fractures over another. And we need to know if the risks and costs of surgery are justified, particularly in this older population. The primary aim of this study is to compare wrist pain and function between two groups, those treated with volar locked plating and those treated with closed reduction and casting. There's lots of secondary aims, which is looking at quality of life, complications, and other outcomes, including x-rays. The study is only looking at patients aged 65 years or over, and they have to have a displaced dorsally angulated distal radius fracture. So it has to be more than 10 degrees dorsally angulated, or more than 3 millimeters short, or more than 2 millimeters of articular step. The patients must be fit for surgery. They must be in independent living, including hostels, so not nursing home patients. They have to have an isolated injury, no other injuries elsewhere or of the same limb, and it has to be from a low energy injury, basically a simple fall. The patient must be available for follow-up for 12 months. Looking at the exclusion criteria, any patient that's not able to consent can't be in the study. The types of fractures, we're only looking at dorsally angulated type A or C fractures. So if it's volar angulated, if it's a partial articular fracture like a Barton's fracture, or if it extends up the diaphysis, these fractures are excluded. Any associated fracture, an open injury, or a previous fracture on the same side is also excluded. So if you have an eligible participant, you need to provide them with the participant information sheet, the PIS, for the randomised arm. We're asking them to participate in the randomised arm. We give them an opportunity to ask questions, and if they agree, you need to get their consent at that time. Now, if they do not want to be part of the randomised arm, we offer them participation in the observational arm of the study. So the randomised arm of the study is the core of the study. The observational arm is really for patients who do not want to be part of the randomised study. They have to be provided with a participant information sheet for the observational arm, and we go through the same process and we get them to consent for that. It's unusual for participants not to agree to the observational arm because it merely involves usual treatment at that hospital, only we're measuring their outcomes afterwards with phone calls. Once you've recruited the patients, you need to fill out the baseline participant forms and then send them off to our office. The contact details are at the end. You can only randomise patients once you have consent for them to be in the randomised arm. To do this, the team member has to contact a central computer-based randomisation service by dialing 1-3000-CROSS, and the randomisation is computerised. So you need to know the number for you, the code number for your site, because you need to punch that in, along with whether it's male, female, and how old they are. And then the telephone will tell you what group they're being randomised to. Once they've been randomised to one of the two groups, these two groups are called the intervention group and the control group. The intervention group is volar locking plate, and it needs to be performed within, in other words, 0 to 14 days, within 2 weeks of the initial injury. The surgical technique and the exact device you use is up to the surgeon. You can apply a plaster splint post-operatively if you like, but it can't be on for longer than 2 weeks. And we encourage active finger movement from the start. The participants should be reviewed around the 2-week mark to have their wound checked and stitches taken out if necessary. And they're also given a home exercise program, which is a sheet of written information that you should provide them with, which is part of the study. You also need to see them at 6 weeks for an X-ray and further follow-up. The control treatment is closed reduction and cast immobilization using plaster splints, usually front and back splints. It's a short arm splint. You should avoid wrist flexion and it should be neutral or slightly extended. It can be done in the emergency department and we would prefer that, but it can also be done in an operating room. Either way, it needs to be done by an orthopedic team member. We need post-reduction x-rays to check the alignment, and the patient needs to be followed up at 1 to 2 weeks, but it's not necessary to do an x-ray then because we will accept whatever alignment we end up with in the closed treatment group. The patients also need to be seen at 6 weeks to have the cast removed and have another x-ray, and at the 2-week mark or initially they're provided with a home exercise program just like the other group to do finger exercises. These are a list of the baseline measures that are in the baseline patient form that you will fill out. So there's just general features of the patient and the injury, and also their baseline outcome scores, and a question asking their treatment preference. Now at follow-up, our primary outcome is the PRWE at 12 months. It's a 15-item patient-reported measure, and all of the follow-up that is done after 6 weeks is done by the central investigators based at Liverpool, and we contact the patient by phone. So once the 6-week follow-up is done, you can follow up the patient further if you wish according to routine practice, but we will follow up the patient anyway for the study, and you don't need to worry about the study after the 6-week mark. The other secondary outcomes are listed there, and you can look at those if you like later. So this is the participant flow. So the patients are going to end up in one of 3 places. Either they're going to be excluded, included in the observational arm, or included in the randomization arm. So once you have a patient with a distal radius fracture, you go through the inclusion and exclusion criteria, and if they satisfy those, you give them the patient information sheet for the randomized arm. Answer any questions they've got, complete the patient form, and if they agree to be randomized, you get consent for both the study and the treatment, whether that be surgery or closed reduction, before you randomize them. This is in case the patient has second thoughts after they've been randomized when they get consented for surgery, for example. So get all the consents done, the trial and the treatment, then randomize them. And to randomize them, you call 13000 CROSS, and it's an automated telephone response system. So you have to punch in numbers for their age and their gender, but also for your site ID. You need to know that number before you make the call. And then the system will tell you what group they've been randomized to and give you the randomization number. And then they're included in the randomized arm. And then once you get all the patient details filled out, you have to send that form to us at the central coordinating office. Now, if they don't want to be part of the randomized arm, that's fine. You offer them participation in the observational arm, so they read that information sheet, and most people agree to that because it just involves usual treatment, only we follow them up by telephone. And if they agree, you include them in the observational arm. If at any stage they disagree or they don't satisfy the criteria, they get excluded. This study currently has over 25 hospitals involved, and each hospital has a site investigator and a site coordinator, and the list is on the next slide. If you want to contact one of the central team members, the lead investigator is Ian Harris, that's me. The clinical trial coordinator is Arazu, her contact details are there, and the PhD student is Andrew. This slide is just for reference. It's a list of the site investigators and site coordinators. So thank you for listening, and please come back to this presentation and use it to review the study at any time. Goodbye.